Should I check my hormones if I have acne? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice specializing only in the treatment of acne. So we like to share our insights and our observations with those who are suffering with acne and navigating the path toward clear skin. So we hope you find this information useful. However, this is not meant to be medical advice. It's just for educational value. So today we're going to talk about something that's very common. So at the Advanced Acne Institute, it's common for patients to come see us and ask about their hormones. Is it their hormones? Do they need to check their hormones? Do they have abnormal hormones? Is that why they're having acne breakouts? So that's a really common thing to happen. Lots of our female patients ask about that. They want to know, do they have some particular issue with one or more of their hormones, and that may be the base of their acne problem. So the reality is that usually we don't check hormones in every patient. We only check hormones really when we see that there's some other clinical suspicion. There's something that alerts us to the fact that maybe there is a hormone imbalance. And that's when we can go looking for a potential hormone abnormality. Now, that doesn't mean that we always see on the surface hormone abnormalities that we can detect clinically. Sometimes there are hormone problems underneath that we may not see with our eyes. So sometimes we do actually find that there are hormone changes that potentially are contributing to acne breakouts that we wouldn't normally have identified if we hadn't done the test for them. But that's not the majority of times. Usually, most acne cases are not really related to detectable hormone imbalances that we can identify in a blood test. So typically we don't go looking for those, and we treat acne as we would in any patient. However, when a patient, for example, doesn't respond well to a particular treatment, or when a patient is having persistent acne, no matter what we do, no matter which treatments we try, or if a patient continually relapses after we clear them with a given treatment, then we start to suspect, well, let's make sure there's nothing else going on, and then we might look for other sources of their acne breakouts, and looking at hormones is one of those things that we might do. Now, as I said, we can't always detect with our eye when there's a need to do a hormone test. Sometimes we can. Sometimes we see telltale signs of excess androgenic hormones, which are the types of hormones that typically are associated with acne breakouts. So, for example, a patient who has excess facial hair growth, or thinning of the scalp hair, or irregular menstrual cycles, or other things like that tip us off that we should really look and see to make sure that the hormone status is within normal range. Some patients have conditions, for example, polycystic ovary syndrome. So in that condition, there is an elevated production of male hormones, which are the ones that are usually behind acne formation. So there are things that tip us off that we go looking. However, it doesn't necessarily mean that we can always identify those right off. So occasionally a patient will be very interested in checking their hormones because they want to be sure that everything is normal. And so sometimes we do that, and very rarely will we find any abnormality. Sometimes we refer a patient to an endocrinologist if we do find or detect any hormone abnormality. And an endocrinologist is a medical specialist, a doctor specializing in hormones. And sometimes that doctor is necessary to help us elucidate the meaning of those hormone evaluations and abnormalities. But most of the time, we find that hormone levels are within normal range, and we treat acne in those circumstances as we would with any acne condition. So it's important to communicate with your doctor if there is a suspicion that you have, if there's something that you've been told in the past, perhaps another doctor checked hormone levels and found something was off, something was elevated or low. It's important to let the doctor know so that further management along those lines and further studies can be done to make sure that your dermatologist or your acne specialist is managing your acne in the right way. However, normally it's not something that's done as a routine test unless the doctor suspects something by either a clinical evaluation or medical history with you that makes your doctor suspicious that there might be something underlying your acne that needs to be further investigated.